Sandra Barteit from the Heidelberg Institute of Global Health, and today I'll continue to speak about CHEERS, which Dr. Alici from Burkina Faso just introduced, and focus more on how we can use this evidence that we are able to generate through CHEERS, for example, for climate negotiations as well. So CHEERS stands for Climate and Health Evaluation and Response System, and you're going to learn a little bit more about it throughout the next slides. So why health evidence determines power? So across the global south, climate change is already shaping, as we've heard throughout the COP, people's health through heat, humidity, air pollution, food insecurity, water stress, for example, yet the health dimension of loss and damage remains largely invisible. Most low and middle income countries do not have continuous high resolution climate health data, but this is exactly what climate finance mechanisms, as we heard from Max, for example, national adaptation plans and legal processes now require. So without quantifiable climate-attributed health burdens, countries receive less adaptation funding and have weaker standing in loss and damage negotiations and in climate litigation and nationally determined climate commitments. So CHEERS was created to fill this evidence gap. So what exactly is CHEERS? CHEERS stands for Climate and Health Evaluation and Response System, which basically is built onto more than 65 so-called health and demographic surveillance systems, which exist in Africa and in Asia. So those are long-term population health cohorts, and these sites already follow these populations over time. And what we do with CHEERS is we turn them into climate health observations. So CHEERS integrates 4 data layers, so individual sensors like wearable devices. We do household monitoring of indoor heat and pollution. We build community weather stations, and we do continuous morbidity surveillance. So the goal is to link climate exposure to health outcomes, so countries can use this evidence in policy, finance, negotiations, and justice. So here you see the CHEERS system as it is built up. So essentially we have 2 pillars which we strengthen in CHEERS. So we have the health-related data with the wearable devices, the long-term morbidity follow-up, as well as the health assessment. And we also strengthen the climate data because most often, especially in Africa and Asia, we do not have climate data, especially microclimate data, so we don't really understand the impacts of environmental exposure on health. So we only understand if we have the data. So this is what we're doing with CHEERS. So we are basically upgrading the database so we actually understand these causal connections. And since we are building a lot of data, we are also exploring novel ways of making or translating this data into information, because you can have a lot of data, but you need to understand also the data. So we are leveraging so-called graph databases and artificial intelligence to help us understand patterns in the population. In addition, just to focus a little bit more on the local weather stations, so this is a core element of what we do. It's the installation of low-cost weather stations across communities as they capture real-time microclimate data. So temperature, humidity, rainfall, also wet bulb flow temperature. And this replaces the coarse national averages that we typically have with hyper-local evidence. It basically shows us exactly who is exposed and when. And this gives communities also their own climate data that is directly usable for adaptation planning, finance application, loss and damages claims, for example. Here you can see we are printing 3D printing weather stations. So this is we've already built 3 3D printed weather stations in Malaysia because they're much cheaper. Because you may know weather stations are really expensive. So maybe you can think in your head how much a weather station may cost. So typically, like a real gold standard weather station is between 10 to 15,000 US dollars, and the 3D printed one we are at around 1,000 US dollars. So you can see this is much cheaper, and essentially we are doing comparison studies, and we see the evidence the 3D printed weather stations are generating are really close to what we see in the gold standard weather stations. And so this is what we do. We build weather stations to understand what is happening in these communities. And we are building them, as you can see on the right-hand side, for example, to cover full study populations. So in Burkina Faso, we have placed 5 throughout the study population to essentially cover as much area as possible. Just to give you a little bit of an example, so in Malaysia, we also work together with these health and demographic surveillance systems, and we study here how heat affects cardiovascular health and what do we monitor. We monitor heart rate, sleep, and activity through the wearable devices. We have 24/7 blood pressure using a wrist-based device, as you can see here. We monitor indoor heat and humidity, as well as outdoor heat and wet outlet temperature from the local weather stations, which I have just shown. So what does this give us? This gives us evidence on how heat affects heart health and daily functioning, which groups are most at risk, and how housing conditions shape exposure. So essentially, these data directly support adaptation planning and loss and damage claims. And importantly, they show how simple digital tools can help quantify heat-related health impacts, strengthening low and middle income country positions in climate negotiations. Another example from our work in Kenya. So in Kenya, we also work together with these population health cohorts, where we combine continuous heart rate data from wearables again with local weather patterns to predict malaria infections early. So the heart rate changes of these wearable devices allows us to detect physiological signals even before symptoms appear. So essentially it's an early warning system. And the data also show how temperature, rainfall, humidity shape malaria risk, creating quantifiable climate disease links. So these links support targeted adaptation actions, such as, for example, vector control, early warnings, and provide measurable evidence for loss and damage submissions when climate conditions drive malaria surges, for example. So CHEERS produces exactly the evidence needed for negotiations and climate finance. So we have these exposure response functions. We have the disease burden estimates, near real-time attribution between weather and physiology. We have the identification of vulnerable groups, adaptation gap mapping, and signals of health system strain during heat waves. So essentially, this is the language finance boards, ministries, and courts rely on. And with this evidence, low and middle income countries negotiate not with narratives, but with numbers. And that shifts the power.